Hi, everyone. Welcome back to SYNLAB Podcast. I remain your host, Uchenna Amadi. And with me here is Dr. Olaniyi Owoeye, a consultant hematologist at SYNLAB Nigeria and a poet by night.
I love that.
Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. In the first episode, we talked about genotype testing, understanding genotype testing and why it matters. Now we will be talking about living with sickle cell, challenges, and triumphs. So back to Dr. Owoeye. What does it mean to live with sickle cell disease on a daily basis?
That's
A very sensitive question.
a very, very sensitive question, and being someone who doesn't live with sickle cell anemia, but anyways, I think I will speak from the angle of the
clinician to
the
those,
clinician, and then because I have sickle cell trait too, so
wow.
maybe in a way I'm related to, I can relate to it. And of course, one of my childhood friends, very good friend, she's a sufferer.
Wow.
And I could remember that, earlier on, when we were younger, I really didn't understand why she wasn't always ready to play all the time. And then there are times I go to their house and then she's just lying there, crying in pain. And of course, as a child, I didn't understand. And sometimes I cry with her because, as far back as I could remember, very painful. She would be crying out in pain, touching, parts of her body. And then the next thing, she's gone to the hospital. And then I remember that she'll be away for weeks, in the hospital and things like that. It was when I got older, I that actually understood what was happening. And that's one of the things that actually inspired me to be a hematologist.
Wow.
Because
amazing.
Yes, because so I guess that qualifies me to say some few things about it. One thing I do know about sickle cell patients is that the pain never goes away. Yeah. So they live with chronic pain. And then they just have these intermittent, acute exacerbations of the pain that comes as crisis. So it's one thing I know is sickle cell sufferers, they've learned to actually live with the pain. There's pain going on every day. So, and that's why for me, I they hold a very special place in my heart because I really cannot just imagine living with pain every day. You understand? So that is, one of the things they have to face. And of course, sickle cell anemia, they're always anemic because, again, there's chronic hemolysis. Now, a normal red blood cell, the lifespan of a normal red blood cell is about 120 days. For sicklers, it's about 10 to 30 days.
What?
About 10 to 30 days. That's why the blood level is never in the normal range. So that's why you are seeing normal PCVs between 18 to 24. So there's chronic hemolysis. And for some of them, even when you look at them, you actually see a change of yellowness, in the eye and all that because hemolysis goes on every day. So that means they have reduced number of red blood cells. So they're always anemic. So that means they're always tired. So chronic pain, chronic anemia is what they have to live with every day. Now, superpose the stress of living in present-day Nigeria on that.
Wow.
So it's, for me, it's not something I trivialize. And it's not something I really want anyone out there to just feel, oh, it's normal. Because
nothing normal about this though.
Yeah, so it's one of the things they have to go through, among other things, the delayed, growth and development. You can actually imagine a 15, 14-year-old girl, 14, 15-year-old girl, 16-year-old girl who has no breast yet. And all our mates are already using bras and things like that. So delayed developmental milestones, and someone who is in his 20s looking like a 13, 14-year-old, you know what that does to the mind, self-esteem and all that. So it's a lot. They actually go through a lot. And these are things, just part of the things, they go through. But the commonest, as I said, the pain never goes away. And then the anemia is consistent. So the tiredness, the weakness, the pain is what they've learned to live with. And knowing that is something you have to live with for the rest of your life, it's not really a nice thing.
Wow.
Yeah.
Wow. That's very touching.
Yeah.
Honestly. But as sensitive as it may sound, permit me to kindly dive in deeper. So I would like to know, are there health challenges aside the pain?
Oh.
Are there common health challenges that they also go through?
There are myriads of challenges from the head to the toe. So let's start from the head. Sickle cell anemia is one of the commonest causes of stroke in young persons. Yeah, so you see young persons having stroke. 10-year-olds, 5-year-olds, 6-year-olds suffering from stroke. So it's one of the commonest causes of stroke in young persons. So that's there. Then they have sight issues from repeated retinal infarction. So there's a sight. Then you have. Then, of course, let's talk about the facial dysmorphism. See some of them having this protrusion of the forehead, protrusion of the jaw. So dysmorphic features, you have it, the yellowness of the eyes, and then you have that. And some of the things they also experience, of course, that we all know is crisis. All form of crisis. The commonest of which is the bone pain crisis. And that was why I said the pain never goes away.
Bone pain.
Yes. We call it vaso-occlusive crisis. 50% of sickle cell patients experience, so it's the commonest. And then you have that, occurring. Some of the health, challenges they also have is delayed growth and development. I mean, I just said something about that. Then there's another thing, subfertility. Yeah, subfertility. I know persons with sickle cell anemia who have had issues with recurrent pregnancy losses. Yes, recurrent pregnancy losses. So that's there. So it's the issue of subfertility. And then, of course, you have other issues because they are prone to also developing complications, kidney failures, chronic leg ulcers. I mean, yes, chronic leg ulcers is one of the complications that they have. So I even have a patient right now that I manage. I mean, he's had leg ulcers for years and it's not going to heal because, I mean, he has the more serious type of sickle cell anemia because clinical presentation varies in patients. There are some of them who may actually have a little bit milder, clinical presentations. But, this patient I'm talking about has the more severe form, and then he has chronic leg ulcers that we've been battling with. It's been managed by surgeons. There's a multidisciplinary thing. And then, again, it has taking a lot of toll on his finances and all that. And now he does not even bother about it. So he goes around with his wound because he doesn't even want to come to the hospital anymore because he's just tired, and he doesn't even really have the means to keep up, so you have some of these issues. So that brings me to the emotional, component of it. Depression.
About to ask,
Yeah, depression. So some of these things I've said brings depression. You see a child who is 14, 15, 16, all the colleagues are breasts, they are, big and all that. And then you're just, it's not funny. And then you have your child telling you, Mommy, Daddy, why can't I be like other children? Why can't I play like them? Why do I have to be, sheltered and things like that? It has a profound effect, on everyone. So, but basically on them. The depression, then the economic impact too, because it's not like a malaria that you treat and then you're fine. It's something you have to live with for the rest of your life. And then you have to really be prepared for whatever, you understand. So these are, it's inexhaustive. Then what about another major complication? Avascular necrosis of femoid. Sorry about that.
Please explain.
Explain. Due to the repeated, infarction in the bone, they may actually have a problem with, the head of their femur. And then when that happens, they develop inability to walk. They can even be paralyzed, and things like that. So these are some of the things that you see sickle cell patients, going through. So the effect is right from the head down to the toes. So it's something that I think everybody should be aware of, and everybody should, be ready to do something about.
Thank you very much, Dr. Ware. So welcome. I will be asking you about myths and stigmas that surround sickle cell disease. What are some myths?
Okay.
I think you mentioned something about Abiku.
Yes, I mentioned something about it. Some of them are seen as being Ogbanjis, as Abikus, because they're always sick. We have several cultural practices here that I think we need to really do something about. You understand? So, because they're always sick, and because we live in a society where we are over religious, there's always this that child is an Ogbanji, people will still visit prayer homes and all that, and then they are tagged and labeled as Ogbanjis, as Abikus. You understand? So that's one thing about it. Then again, there's another thing that I think we practice unconsciously in the society. We tend to disenfranchise sicklers. We tend to, sometimes we don't say it out. Sometimes we don't vocalize it. But then there's this unsaid stigmatization about sicklers where you actually feel because they are sicklers, then you can't really achieve certain things in life, or you don't really allow them to do certain things. Yes, we know that there are certain things of course you have to protect them from, but you still find that in some places, some gatherings, once people are sicklers, they are excluded, in a way. You understand? Because they feel that these people are some people still think that sicklers would almost always die. You understand? So everybody is always looking at them with that eye that the child that will soon die, that person that will soon die. Please, you understand? So even if sometimes they are saying their mind or trying to be heard, and they're just trying to show you that, well, I'm a sickler, but then I still can function. It doesn't mean I'm limited and things like that. In a way, we still do that. We still try to exclude them, and I don't really think it's good. I don't really think it's right, because I've met a lot of very intelligent sicklers who are really, trailblazers.
Yes,
you understand?
So, I have actually.
So
I have.
Do that.
Okay. So I wanted to even mention one myth, but the myth is targeted towards the hemoglobin genotype.
Oh, okay.
So when they tell you, okay, you want to get married and you are AS and your spouse or your intending is an AS, then you hear this, our African mothers, they will now come out in their wisdom and knowledge and tell you, oh, you're AS and he's AS. Your first child will be AA. Then the second one will now be AS. The third one will now be AS. And the last one will be SS.
Okay.
And I don't think they know that it is a probability. I know they taught us something like that in school, but I think it's a probability thing. But they have already planned it for you. That your first child, don't worry, once you born the first and the second, don't born the third one though, if you want to go ahead. So what can you say about that?
Right. I think I like that. I actually totally forgot about that. Thanks for bringing that. Yeah, it's true. So maybe those mothers are biologists. So they will do the simple Mendelian cross.
Yeah, Mendelian cross. I was trying to remember the name.
But really, every pregnancy carries a 50% chance of it being SS. So it's possible for you to have all your children SS.
Yes.
And it's possible for you, if you're lucky, to actually not have.
I have seen.
Yeah.
Shockingly. So, my mom's friend.
Okay.
No single.
How many children does she have? 4. Interesting. That's
I think
rare.
1 AS, 3 AA.
Oh, that's rare.
The lady is always saying, oh, is it the man? He's always saying, I'm the one that God loves.
Did she know before she got married?
I think they knew. Those days now, people didn't...
faith in it.
I don't know.
And love conquers all.
I don't know. But I know that what we know now, they didn't know then.
Yeah, sure.
So I think it was just a lucky gamble.
And I don't really think anyone wants to actually plan their life on a gamble.
Yeah.
They don't want to gamble with your life. Because one of the things I tell people is, what will you do as a parent when your child asks you a question and says, "Mommy, Daddy, why am I always sick? Why am I not like other kids?" So what would you say if perhaps before you took that decision, you knew?
Yes.
So I'm not sure it's something you as a parent want to live with. You understand? So for me, I will reiterate again. Every pregnancy carries a 50% chance of it being the child being a sickle.
Yes.
So it's not textbook. It's not by simple Mendelian cross.
Yeah. Please,
so that's a good one.
Thank you so much. So coming to the caregivers and the support groups, what are their roles? How can they help to, manage or assist the people affected by this?
Oh, good. Well, I think the first thing is for you to understand the disease itself. As a healthcare provider or as a primary caregiver or as a support group, NGO or anything, the first thing that you need to do is to understand the disease itself. Because when you understand the disease itself, it's going to actually inform, and what other things are actually going to do in terms of managing, the disease as it were. So understanding is the first thing. We need to understand that. Then all healthcare givers must actually create platform that encourages accessibility to care. We really need to understand that, to create that accessibility to care. It's not just all about understanding the disease itself. You need to actually, have this open door policy and, have like a listening policies where you actually allow the sufferers themselves to be part of, their management. It's their body. They know what's going on with them. You should be that open. You should have that policy where, they can be, they have the right to actually also have a say, on their management, and they must always feel like they are being heard. It's very, 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 very important.
Yeah.
And then aside from accessibility to care, that is also very, very important. Then, of course, there must be systems put in place to actually ensure that, their access to care is seamless. It's very, very important. Now,
don't come and add stress to distress already.
Good. So as a healthcare provider, I don't want my sickle cell patients to actually, spend a lot of time in the laboratory.
Yeah.
They're coming to do a test and then they're not getting results on time. And then they are coming with a crisis into the emergency ward. They're not being attended to on time. You understand? And I would say this, I think one of the most profound experiences I had, as a medical student, that was my final year then. We were preparing for our final exams. So I decided to, be going to the accident and emergency back then to see, some of the cases as they are coming in fresh.
Okay.
I could remember was one particular night where there was like a mass casualty of sorts. There was a lot of people coming in, into the accident and emergency. And there was this particular man who, from the look of things it looked, like someone who had sickle cell anemia, then he was coming in with pains. It was bone pain crisis that day. He had so much pain. It was severe pains. And then he was there. Because I was a medical student, there was nothing I could do. And of course, you really couldn't blame the doctor. I think it was only 1 or 2 persons, attending to like 10, people who were really bad.
Wow.
So he came in crying, and then, well, I don't like saying this, but he died that night, we were collecting samples when he died, and then he had been there for, hours, crying out in pain and all that. And I'm sure, so these are some of the things you also don't want as an healthcare provider. You actually want them to be attended to on time, have access to their test on time, and then attended to on time, and things like that. And then as the support person, as a primary caregiver, understanding of the disease, is important, as well as understanding the triggers of crisis and then what you actually need to prevent crisis. So every person who is affected by sickle cell anemia, whether parents or guardians or whatever, you really need to be able to understand that and then be able to actually, provide care at that point. Then you need to listen to their emotional needs, because I think that's one part here in this part of the world that we don't pay too much attention to. People's mental health needs, emotional needs. A lot of these people are depressed. I've heard of a sickle cell sufferer. A person is actually a medical practitioner who committed suicide. because he couldn't bear the pain again.
Oh,
He
wow.
committed suicide, and it wasn't noticed until about 24 or so hours afterwards. So these are some of the things that you really need to, as a primary caregiver,
pay attention.
Yes. So these are some of the things you really, really need to pay attention to. And of course, it takes a whole lot of, a lot out of your pocket. And so you must be ready for that.
Yeah.
You understand? It's very, very, very important. And then for the NGOs also, they must also, aside from the fact that they understand it, they must also be able to facilitate policies, that will ensure, seamless care of, sickle cell patients, and of course facilitate testing. And most of them dwell a lot more on awareness, you understand? And then awareness, you can never do wrong with awareness.
Sure.
Education of the public, about it, disabuse our minds of, like, some of the things that we are doing here today. We are trying to actually disabuse people's minds of some things that they are actually, being used to, condition their minds to, about it. So these are some of the ways I actually feel we can actually, help.
Wow. Dr. Owoeye, this has been an interesting episode.
Thank you.
Once again, thank you for taking your time to break things down. To my listeners, you have heard. I don't need to say more. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. Don't go away. It is getting more interesting. Thank you.